Today with me in the studio is Patrick Crowley, massage therapist, body worker, and yoga teacher extraordinaire. And then we have Yuan Ling, who's an acupuncturist, herbalist, and registered dietitian. So welcome to our show.
Thank you.
Today's show is on insomnia or sleep disorders, and I'll kick off with you, Yuan Ling. What's insomnia?
Insomnia it's defined that someone have a certain period of time having trouble falling asleep, staying asleep, or light sleep, dream disturbed sleep. Sleep's supposed to help us to rejuvenate energy. I think we get at least 50% of energy, daily energy from sleeping. A lot of people long-term taking it develop dependency, and also after our body also get resistant, which means you have to up the dosage in order to have the sedative effect at night. And the other side effects, you're waking up feeling drowsy, that your body's still asleep. Yeah. So all the side effects, you look at it, it's will leading to a lot more problems.
There are supposedly 60 million Americans who suffer from insomnia. So it's a very, very big concern, and they're all different reasons, all different kinds of insomnia.
Yeah. And I was also reading that 10 million people use prescription sleep medications regularly to go to sleep. So it's a huge problem. Why do you think it's so prevalent in our society?
Well, there are a lot of stress and our lifestyle. So I feel if anyone who has insomnia, first you want to examine in your daily life whether it's your eating habit, your lifestyle, and or your work pattern that's interfering in your health. I think insomnia is just one symptom that's crying out, saying that there's something wrong. Yeah. So by just taking sedative medication, it's just suppressing the symptom. It's not dealing with what's happening in the body.
Today we'll try to cover some on herbal medicine, vitamins, lifestyle changes, like you were saying, Yuan Ling, massage therapy, behavioral therapy, meditation, acupuncture, and relaxation techniques. So all of these are holistic ways of working before you should consider prescription medication, wouldn't you say?
As we get older, our body function declines, and insomnia become one of the common symptoms that appears. And we spoke earlier about what happens to our body when we are long period of time unable to get the rest. Yeah. When we are sleeping, our body is supposed to be rejuvenating. For example, repairing hormone are released when we are in deep sleep. Growth hormone are released during deep sleep. So a lot of chronic inflammation are happening in our body. If we are unable to get the rest we should be, then we are not able to function efficiently, work efficiently, think straight.
Right, so the herbal medicine approach, how would you approach someone with insomnia in your acupuncture and herbal practice?
So we are very individualized because everybody's insomnia are a little bit different. For example, a lot of people have trouble falling asleep. Let's put it as an elderly person who have trouble falling asleep, otherwise healthy. People who have trouble falling asleep, in Chinese medicine we identified tend to be blood deficient. In Chinese medicine, at night the blood are stored in the liver, and also the blood helps to house the spirit. The spirit being our mind. So when blood is deficient, so the spirit are easily agitated. So any little noise, any thoughts, overthinking, so all of those things start become a snowballing that the more you want to fall asleep, the more awake you are. Right. So we will be prescribing herbal medicine to support the blood, to nourish the blood and nourishing the energy.
Actually, 2/3 of the adults in the US experience some kind of sleeping problem a few nights per week or more during the past year. So of all those people that are suffering, you think massage would be able to help them? I mean, as a massage therapist, I'm sure you...
As a massage therapist, as a yoga teacher, I think that massage helps, but I think the very first piece is the lifestyle changes. Yeah. I think, certainly there are people who have insomnia because of some sort of chemical imbalance or possibly a mental disorder, but that's really a small minority of the people. Mostly it's common people who are just making the wrong choices in their life. And so the biggest piece is the basics, getting enough exercise. People recommend that you get a half an hour of exercise either in the morning or the afternoon, early afternoon, and really get the body going. The dietary, certainly what foods, but the very first thing is when people eat.
Right.
So it's really recommended that you don't have anything to eat, you know, really 3 hours before you go to sleep. That's what's best.
This is like 40% are women, so 10% more women. Why do you think that is, Yuan-Li? Just more blood deficiencies in women, from a Chinese perspective?
I think women are more susceptible with a lot of, one thing is women are more hormonal driven, and also we are more sensitive. You know, a lot of women
emotionally more receptive,
right.
Emotionally more sensitive.
Right.
Maintain a regular wake time. So the whole idea of waking at the same time, going to bed at the same time is very important. Avoid excessive time in bed. So if you're not able to sleep, don't, you know, the idea of trying to spend more time the next day trying to get extra sleep is important to try to keep the same regular ritual. Avoid naps. The idea of, you know, napping midday as a way of catching up on lost sleep throws the body's natural rhythm out. The other one is avoid nicotine, caffeine, alcohol before bed. Also large meals before bed. Exercise regularly. If you can, early in the day is recommended. Do something relaxing before bedtime. You know, many people on the computer working away, and then their head hits the pillow, the mind is still racing. It's very difficult to get off to sleep. So to try to do something more relaxing before bed. Now, a lot of people watch the clock. Oh, it's 1 o'clock, it's 2 o'clock. I'm not sleeping. The anxiety builds. And then the idea is to, if you are excessively hungry, to have a very light snack. Those are the kind of conventional wisdoms. What would you add to that, Patrick?
Well, I also want to underscore those. I really think the determination to do that list would take a lot of determination.
That's
It's
true.
exactly
That's true.
what we need. But it's incredibly difficult for most people to change these patterns. The thing that I would add that I think helps get all of these others done is some sort of relaxation technique, some sort of meditation. There are many tapes that you can buy. You
So
can
give the
listen to
mind
them.
something good to do instead of creating more anxiety about not sleeping.
Right, and meditation, what it does is clear the mind of excessive thought.
Yeah.
And basically gets you more into your body, feeling what's really true for yourself.
In Chinese medicine, there's this idea of yang being activity, yin being inactivity. And to be nourished by sleep is the deepest yin. You know, it always strikes me, you know, that there's the REM, rapid eye movement, phase of sleep, and then the non-REM, where nobody's quite sure what's going on in the brain. The activity really shrinks down. The eye isn't moving, following dreamlike figures. There's no dreams going on, is the best guess. That's the deepest yin, the most nourishing part of the sleep. All of that is a tone of the nervous system. So the idea of, you know, being overactive in one's life would be the excessive yang, and then that would lead to a depletion of the yin. Very difficult to switch that off and maintain a balance between those nervous systems. Massages are more prevalent these days. 14 million massages, and I came up with a study on the hormones, that massage stimulates the release of hormones, enkephalins and endorphins that can last for up to 2 days. So that kind of idea of that deep armoring, that tension from a very busy day that's stored muscularly. You must see that all the time, that your patients, Patrick, who come to you for massage at the Darcy Wellness Clinic in Natick, also learn to sleep better. The amount of stress in our society, that 84% of all doctors' office visits are related to stress.
Right.
That 80% of workers feel stress on the job. You know, that it's showing, you know, I think probably a high degree of stress more than probably 2 decades ago, more than 2 decades before that. People were working harder, longer. So acupuncture. Can you talk to us a little bit about how acupuncture helps to tone down stress, help people sleep better?
And acupuncture definitely is very helpful. One thing is that acupuncture shown, you know, that helps better relaxing the body, and also there are a lot of studies have measured, you know, during acupuncture when people are in relaxed stage, there are a lot more endorphin and melatonin are relieved, and those are the hormones help you to relax better and help you to able to sleep.
That's interesting. You know, the increases nocturnal melatonin secretion is that melatonin peaks at 2 a.m. and DHEA, the hormone of consciousness, peaks at 10 a.m. So it's like almost like the yin and yang of hormones, and unless we're able to be in a deep relaxed state to have that melatonin produced, it's very difficult. So there's actually a study that you came up with that showed the increase of melatonin by acupuncture.
Right, and also, you know, in general, acupuncture itself, it's very relaxing, and you know, we also teach patients to, you know, when they're relaxing on their bed, you know, put yourself in the same position as, you know, after the acupuncture effect. Most people all feel very relaxed after acupuncture treatment. Larger meals shouldn't be eaten at night. Just in general, our digestion system slows down and our metabolism slows down too. Imagine all those things that sits there. At night, our body's supposed to be, you know, working on the deepest healing and also restoring rather than still producing acid and digestion absorbing. That creates a lot of people who eat late at night, large meal, they tend to have dream disturbed sleep, even though they're in sleep, but they're not getting the
a very deep nourishing
sleep.
sleep. The idea of that herbal medicine is a very good potential alternative to pharmaceuticals. You know, that you can take some herbs on a regular basis to help balance the constitution. That acupuncture helps to relax, as does massage, body work, exercise, staying away from alcohol and food late at night. All of these are factors that really help the body to achieve a deep, nourishing sleep. Thank you very much for coming on the show.
Thank you.
Hopefully this show hasn't sent you to sleep.
Hopefully it has.
Hopefully it has. That you have some good tips with which to achieve a more deeper, nourishing sleep and achieve greater wellness in your life. From me, Jeff Darcy, at the Darcy Wellness Clinic in Natick, thank you very much for joining us. And we wish you and yours all the very best for your health.